Good morning all. Today's our topic is continuation of the larynx. Now here the mucous membrane of the larynx. The anterior surface and upper half of the posterior surface of the epiglottis, the upper parts of the area epiglottis fold, and at the vocal folds are lined by the stratified squamous epithelium. The rest of the laryngeal mucous membrane is covered with the ciliated columnar epithelium, and the mucous membrane is closely attached to the cartilages of the larynx and except over the vocal ligament and over the posterior surface of the epiglottis, where it is thin and firmly adherent. The mucous glands are absent over the vocal cords, but are painful over the anterior surface of the epiglottis, around the cuneiform cartilages, and in the vestibular fold. The glands are scattered over the rest of the larynx. Now it's clinical anatomy. Since the larynx or glottis is the narrowest part of the respiratory passage and foreign bodies are usually lodged here, the infections of the larynx is called laryngitis. It is characterized by hoarseness of voice, and laryngeal edema may occur due to a variety of causes. This is can obstruction to breathing, uh, misuse of the vocal cords may produce nodular on the vocal cords, mostly at the junctions of uh, anterior one third and the posterior two third. This is called Singer's nodules or Tichel's nodules. The fibroptic uh, flexibility laryngoscopy under local anesthesia. Flexible laryngoscope is passed and the larynx wall visualized. Microlaryngoscopy. This procedure is performed under operating a microscope, and vocal and tumors are and diseases are excised by this method. And external examinations of the larynx. Head is flexed in sagittal position. Sorry, head is flexed in sitting position, and examine stands behind the palpates larynx and neck with the fingers tip for the tumor swelling and lymphadenitis. Speech analysis is also necessary in a laryngeal disease. Foreign body in the larynx, it times fish bones may get impacted in the follicle or the piriform fossa. Piriform fossa lies between uh, quadrate membranes and the medial side of the thyroid cartilage. The mucous membrane of the larynx is supplied by X nerve through superior laryngeal or the recurrent laryngeal nerve. The large foreign bodies may block laryngeal inlet, leading to suffocation. Small foreign bodies may lodge in the laryngeal vertical, causes reflex closure of the glottis and suffocation. Inflammation of upper larynx may causes edema of the supraglottis part. It does not extend below the vocal cord. Here this is the figure of the Singer's or Tichel's nodules. Now, intrinsic muscle of the larynx. The attachment of the intrinsic muscle of the larynx are present in the table number 16.1, and another its section is 16.2. Now supply all intrinsic muscle of the larynx are supplied by the recurrent laryngeal nerve except for the cricothyroid, which supplied by the external laryngeal nerve. Action. The vocal process and the muscular process moved in the opposite directions. Any muscles it pulls the muscular process medially, pushes the vocal process laterally, and resulting in the abduction of vocal cords. This is done by only one pair of muscles and posterior uh, cricotonates muscle which is pull the muscular process forward and laterally push the vocal process medially, causing the abduction of the vocal cord. The cricothyroid causes rocking movement of the thyroid forwards and downwards and cricothyroid joints and the tensing the lengthening of the vocal cord. Now this is the table number 16.1 index muscle. Its origin in vibration insertion. Now here the cricothyroid, the only muscle in, outside the larynx, origin lower border of the lateral surface of the cricoid fibers ever passes backward and upward. Insertion inferior cornea and the lower border of the thyroid cartilage. It is called tuning fork of larynx. Posterior cricothyroid triangular. Posterior surface of the lamina of the cricoid and upward and laterally. Posterior aspect of the muscular process of the erythronoids. Lateral cricoid muscles. Lateral part of the upper border of the arch of the cricoid and its fibers upwards and backwards on insertion. Anterior aspect of the muscular process of the erythronoids. Now, fourth one is transverse erythronoid, unpaid muscle, posterior surface of the one erythronoids and its fibers transverse and its insertion posterior surface of the another erythronoids. Now 5 and 6 oblique erypiglotic. Its origin from muscular process of one erythronoid and its fibers oblique apex of the other erythronoid. Some fibers are the continued as the erypiglotic muscles to the edge of the epiglottis. Now 7th and 8th thyroidnoids and the thyroepiglotic. It arises from thyroid angle and adjacent cricoid thyroid ligament and its fibers backward and upwards. Insertion anterolateral surface of the erythroid cartilage and some of the upper fiber of the thyroids curve upwards into the erypiglotic fold to reach the edge of the epiglottic known as the thyroepiglotic. Now it vocalis, vocal process of the erythroid cartilage and its fiber passes forwards and insertion vocal ligament and thyroid angle. Now table number 16.2 muscle action on the larynx is movements. The first is elevation of the larynx muscle, the thyroid and the mylohyoid. Secondary depression of the larynx, sternohyoid and sternomyelor muscles. Opening inlet of the larynx and laryngioepiglotics. Fourth one is closing inlet of the larynx and its muscle is erypiglotic. Abductor of vocal cords and muscle posterior cricoerythronoids only, and adductors of the vocal cords lateral cricoerythronoids transverse and oblique erythronoids. And 7 the tensor of vocal cord and the modulation of voice cricothyroid, and 8 is a flexor of the vocal cords thyroerythronoids and the vocalis. The thyroerythronoids pulls the erythronoids forwards, flexing and vocal cords, and the muscle which abduct the vocal cords only posterior cricoerythronoids safety muscles of the larynx and muscle which abduct the vocal cords, lateral cricoid and transverse arytenoids and cricothyroids, tuning fork of the larynx and uh, thyroarytenoids, muscles which tense of the vocal cord, cricothyroids and muscles which relax the vocal cord, thyroarytenoids and vocalis. The muscles which close the inlet of the larynx, oblique arytenoids and epiglottis. Muscles which opening the inlet of the larynx, thyroepiglottis. Now it is clinical anatomy. When any foreign object enters the larynx, severe projecting cupping in the excited to the expel the object. The damage to the external laryngeal nerve causes some weakness of the phonations due to loss of the tightening effect of the cricothyroids of the vocal cord. When both recurrent laryngeal nerves are interrupted, the vocal cords lies in the cadaveric positions in between abduction and adduction, and phonation is completely lost. When any one recurrent laryngeal nerve is paralyzed, opposite vocal cord components. Shortness of the voice is a failure of the forceful expression on the part of the voluntary reflex coughing. Tumors in the piriform fossa causing dysphagia. Recurrent laryngeal nerve mediastinal tumors may process on left recurrent laryngeal nerve. It is given of the thorax. Now this is the movement of the vocal cord during quiet breathing or conduction of the rest of the membranous part of the rami triangular. During phonation or speech on glottis is reduced. During force inspiration both part of the rami and triangular. During whispering in the intermembranous part of the hemiglottis. This is the figure of cricoid muscles, and second is the muscles of the larynx and posterior view. This is the figure of the lateral view and horizontal view of the muscles of the larynx. Here the figure of the schemes to show duration pull the intensive muscle of larynx, and another figure is various position of the vocal cord, and here the figure of the position of the vocal cords, normal and abnormal condition. And here is figure of the rima glottis in quiet breathing, phonation of speech and duration forced inspiration and during forced inspiration during whispering. Now here the arterial supply and venous drainages.